So I've always been fascinated in people and emotions and what drives people, what motivates us and why we make the decisions that we make, why we have the relationships that we have and the choices that we choose. And initially the way that took shape was actually in music and performing. Ever since I was a child I was very into music, loved music and still am. I think once you consider yourself a musician you probably always are one, although I don't do it professionally anymore. But just loved music as a child, was always into singing and very attuned to the lyrics that were about different emotions. A lot of songs are written from an emotional place about heartbreak and loss and relationships and things like that. And I recognise now that I was learning a lot about relationships and attachment and emotions and feelings. And after university initially went into the music industry and was working with performers there in that capacity. I was again learning a lot about relationships, seeing people in bands and in groups, producers working with musicians, things like that, watching performers and thinking about what was going on there, what was going on in their nervous systems. A lot of performers have highly attuned nervous systems. And then also being a musician myself, singing and playing an instrument myself. And looking back now, there was a lot of learning about the nervous system. When someone's sitting with an instrument or learning how to use their voice, they're really fine-tuning their nervous system and learning to be very, very attuned to their nervous system. The amount of time it takes to figure out how hard to press down a guitar string, which strings to press down, how to play the perfect chord, how to move your body and your vocal cords and all of that all at the same time. There's a huge amount of attunement with the nervous system there, in the same way that an athlete might learn how to hit the perfect shot with a tennis racket, how to hit a cricket ball, how to throw a basketball. An actor might learn how to train their vocal cords, how to say the line by channeling the exact correct emotion, how to get into a character. And I realise now that actually that was all learning about performance and the nervous system and psychology. And it was after having been in the music industry for about 10 years that actually my love for psychology came back in, and I went and studied on a master's course in the US and became very fascinated by relationships and people and systems. You know, thinking about people in a systemic way, thinking about the way that we relate, the way that we create relationships as couples, when we have dyads and third parties outside of that, when we have group connections, families. Very interested in systemic working. So studied a lot about attachment and relationships and was really thinking about relational work. My first role was then back in the UK within the NHS as a clinical lead for addictions within NHS Brent in northwest London, and leading a structured day program there that was 5 days a week for people recovering from addictions. And really, when you're working with addiction, you're working with people who have created maladaptive coping strategies, often for attachment trauma, attachment loss and attachment ruptures. And the substance itself, whether it is a drug or drink, whatever it might be, has become a replacement for healthy attachment. So the attachment is now to the drug or to the substance, whatever it might be, to the habit. So you're working with attachment. It's still about relationships. And again, really working closely with the nervous system and understanding what was activated for people, what was going on for them when they felt dysregulated. And they were trying to reach a place of regulation by using that external soothing strategy. They had learned to self-soothe rather than to be able to co-regulate in a relationship with others, which is what we're wired to do and what we learn to do in therapy with the therapist. So that's a little bit about my background. I then went from the NHS into private practice and I had been doing traditional talk therapy, doing psychodynamic therapy, cognitive behavioural therapy, CBT, doing those sorts of approaches with clients, but always very interested in the nervous system. And I discovered brain spotting about 10 years ago now, and then went on and studied all of the phases of brain spotting and became fully certified in that. And that was a great way to start to work, I think, with the whole person, rather than just with the brain and the thoughts and the cognitive side of things, really thinking also about the body and the nervous system. When someone comes into the room in therapy, they're not just bringing their mind, they're also bringing their body and their nervous system. So it was really a way of getting back around to working with people's nervous systems in a way that I had been, without realizing it, when I'd been sat with my guitar or singing and being highly attuned to what was going on internally, developing a skill that we would call interoception. So brain spotting has been a way into that, helping clients to develop interoception, to understand their own nervous systems, to understand what the things might be that get them activated, that create dysregulation in the nervous system, and to really start to work with that, to get back into a state of calm and safe regulation and a state of optimal flow, which is ultimately where we would like to be when we're performing. So that's the path that I've taken, and a lot of the work that I do with clients now is about recognizing blocks in the nervous system, and those could be performance blocks. Doesn't necessarily mean that you have to be a professional performer. We all perform in our lives in some way, whether it's at work or in our relationships. An example of a performance block might be sexual performance, where someone feels that there's a block such as erectile dysfunction or premature ejaculation or something like that, where there is a block that is coming from deep in the nervous system that manifests as a physiological symptom, as a physiological block. So we're working with the nervous system, working with performance, and really trying to identify blocks, discharge those blocks, understand where they're coming from, often from a sense of anxiety, fear, trauma, which may come from formative experiences, and to discharge those to free up any blockage and then get people back to a state of optimal flow so that they can perform in a way that they want to in their lives, whatever that might look like. Could be about public speaking, could be about simply getting out there and feeling safe and social in our own nervous systems, just really being able to be our best selves. So people come into therapy often because there's a sense of something missing. It's not always a crisis. It's not always a specific issue. Sometimes there's just a nagging sense that something is missing, or I'm not my best self, I'm not performing the way I wish I could be. That's a great time to come into therapy and to be able to identify what's happening in the nervous system. And it may manifest as thoughts. It might manifest as behaviors. It could be something habitual, like I'm trying to give up smoking and I can't stop, or I seem to have this addiction that's taking over, or I'm not happy with this behavior in my life. Behaviors are easy to spot sometimes because we can see those externally, but there can also be process addictions, and a process addiction is almost a habitual way of thinking that is unhelpful, and often those are much harder to spot, and people won't even know that they're having them. They've just fallen into unhelpful routines and certain ways of seeing the world and thinking. So someone who's got pure OCD, for example, which is a form of OCD that's purely cognitive, purely in the mind, will get locked into very restrictive patterns of thinking about the world, and things have to be a certain way, have to be kept a certain way. And to others, they may see the behavior, it might look like having to keep the house constantly in a certain order, having to tidy after themselves, or having to check everything multiple times. But obviously in our minds, that can be even more restrictive, even more stifling. So thinking about ways that these things can manifest, when the nervous system gets dysregulated, all these different ways. So people come into therapy because they have this sense that something isn't right, or they're not their best selves, and they want to work with that. And we can do that work together in the sessions and really start to change things for people.